Hi, I am Dr. Sandeep Harkar. I am Principal Consultant in Urology at Manipal Hospital Gurugram. So let's discuss about prostate gland. You must have heard a lot about prostate gland causing problem in the flow of urine, people suffering from prostate. So let's discuss what is it all about. So see, if in this model I'll explain to you, this is the bladder where the urine gets stored and urine has to pass through this passage to the outside. And just beneath the bladder there is a gland. It's a round walnut shaped gland which surrounds the urinary passage, that's the urethra. So in young age this prostate gland is very small in size and it doesn't cause any problem to the flow of urine. But as the age increases, naturally the prostate increases in size. So imagine this entire round thing is pressing onto the urinary passage, that's the urethra, and causes problem in the flow of urine. So what does the patient encounter? Patient feels that his flow has become slower than before. He feels that it takes him longer time to empty his bladder. He also feels that he has some urine left out in the bladder even after he has finished urination. He may have to get up multiple times in the night to pass urine. So all these things may be because of the enlargement of the prostate gland, especially in the elderly age group after 55 to 60 years of age. So now at this stage, when the prostate has increased and it has chinked the urinary passage to some extent, many times we can prescribe some medicines, some tablets which can decrease this pressure which the prostate is creating on the urinary passage so that the flow becomes normal. So that can be very well managed medically. However, as the size of the prostate increases, if we see further, when it increases more, sometimes it may actually occlude the urinary passage completely. So if the occlusion is complete, the urine doesn't pass. You must have heard the people not able to pass urine at all. In that case, they need to undergo catheterization. That means you have to put a tube into the bladder through this passage, through the prostate, so that the bladder is drained. So that is called as severe BPH. So this is called the enlargement of the prostate. So there is another condition where the enlargement of the prostate is there, but it is an abnormal enlargement. It's called as prostate cancer. Here again, the prostate is the same, the gland is the same, it is enlarged, but the type of enlargement is not natural, it's not normal, it's abnormal, it's cancer. So these are the various stages of prostate enlargement and also cancer. So treatment of prostate enlargement, which is benign, which is age related, is simple. What we do, we treat it with medicines, and if required, we may treat it with surgery. So what is the surgery for prostate? For prostate surgery, we go by the urine passage endoscopically without any cut and create a passage through the prostate so that the passage is all opened up. However, in case of a cancer, if the diagnosis is the prostate cancer, what we do, we have to do a proper staging, and then we might have to remove the entire prostate gland by a surgery, robotic, open or laparoscopic techniques, so that this entire thing is taken out. So the treatment for cancer and the normal enlargement is different, and the symptoms can be managed initially by medicines and if required by very safe endoscopic surgeries.